over a month, many Ontarians have been unable to get an eye exam due to the ongoing dispute between Ontario optometrists and the provincial government. One mother says her 9-year-old daughter is struggling and there's nothing she can do about it.
Most nights when she gets home from school, we do end up having to give her Tylenol or ibuprofen so that she can have a bit of downtime in the evenings without having a headache and be able to go to sleep.
This Guelph mom's 9-year-old daughter has been experiencing headaches for the past month. Natasha Smith thinks it's because of all the screen time due to remote learning during the pandemic.
It's a simple fix for her to be seen and to get some glasses to improve her educational experience.
On September 1st, Ontario optometrists put a pause on offering services to OHIP-insured patients, which generally includes those under 19 years of age, seniors, and individuals with certain special eye conditions.
We aren't able to deliver the quality of care that we need to for patients in this province. The system is completely broken and it's completely stressed.
2,100 optometrists across the province are asking the government to work out a funding deal they say should match the same compensation their counterparts in other parts of Canada receive for an eye exam.
They pay us on average $45 for an eye exam. We have multiple data points that suggest that the cost to deliver those services are around $80. When we're talking operating costs to provide these services, we're talking about the basic things like rent, utilities, our staff salaries, our insurances, our equipment that we require.
Last month, Ontario's Health Minister Christine Elliott proposed a funding increase of 8.49%. Elliott also announced she would make a one-time payment of $39 million directly to optometrists. The president of the Ontario Association of Optometrists says that would still result in the average optometrist paying $27 out of pocket to examine an OHIP-insured patient. He adds they don't want this money until a fair deal is reached.
We want them to either ensure that optometrists in Ontario are no longer compensated at the lowest rates compared to other provincially funded programs in other provinces across the country, or we want them to commit to actually paying these operating costs.
Smith, who has contacted her local MPP multiple times, is shocked the dispute is still dragging on. She says she would pay for her daughter's eye exam if she could, but that isn't allowed.
It makes me livid to be living in Ontario and to not be able to have my child seen for something as routine and necessary as an eye appointment.
The president of the OAO says nearly 15,000 eye exams are being canceled daily across the province. He says urgent cases are being redirected to other healthcare providers, and the OAO also adds they haven't heard from the province in nearly a month.